so I can see what this, what this particular thing is. In Australia, a lot of doctors have them, but most don't. But if a doctor's not doing a skin check and then looking at your moles with, not necessarily this particular device, but with a handheld magnifying device, they're not in the game. Once again, the problem is they were never taught at med school. It's one of those things they have to have an interest and put their hand up effectively to be able to do it. But yeah, I mean, you could buy this tomorrow if you wanted to. These things come with, I don't know if I've got the picture here, there it goes. So it's a portable handheld device, take the photo, you can slip your iPhone on it, you can make the picture bigger or smaller, and then you've got an app that goes with it. And that's really what it is. I mean, the old world of, having to wait, referral, having to wait, sit in a waiting room for 2 hours, all this sort of stuff, which is what medicine's all about. In the future, it's about instant information and instant gratification, realistically. The younger population is not going to wait 3 months to see anybody. They'll Google it and find a solution and work it out themselves. So I suppose we're just conscious of the fact that, we believe that once again that, this current barrier that medicine has to letting people have access, the consumer's just going to run straight past them. I mean, that's the problem with the profession sometimes, is that they sit there and go, no, we like the way it is. Well, unfortunately, the world is changing, and changing very quickly. And you have a choice either to be part of it or to be left behind. So we find a lot of older doctors are like, well, don't need to learn the computer, don't need, I'll eventually walk off to the sunset, maybe that's okay. But, the rate and pace of change is, significant. And particularly in medicine, as I said, these devices used to be very expensive and very hard. Now there's stuff that a patient can use and play with an iPhone app. So, yes.
So my daughter went into dermatology in Canada for 3 reasons. Nobody got better, nobody died, and nobody's going to do it at 2 o'clock in the morning. But over there, they don't refer them to the dermatologist. They go straight to the skin cancer, to the under the fibers. So dermatology. And I think that's the trouble with the UK. Then GPs don't do invasive surgery, do they?
No. I mean, the guidelines say they shouldn't. I mean, the other thing to realise, somewhere like England, is they don't have continuous professional development. So here in Australia, as a GP, you have to, well, if you wanted to, bill Medicare, obviously the higher available fee, you've got to continuously professionally develop yourself. In America, you've got to do it as well. In England, you don't. It's not. And most doctors there are NHS employees, so there's not a lot of incentive, I mean, part of the incentive for doctors here to do skin cancer work is it pays very well, and it's not very hard to do. It's probably one of their motivations, but in England, as I said, there is no motivation because, if I see one patient, I see 1,000, I don't get paid anything different really, so, and why would I want to take that risk of managing that thing that potentially could blow up in my face if I don't manage it properly, so let's make it someone else's problem and pass it off. So it is, it is a bit of a challenge. And like I said, what's interesting is that, skin cancer is the same thing all over the planet. It's called the same thing, treated the same way, but then when you go to different countries, then you find there's just this different set of rules and different set of structures. And some of it's excellent and some of it makes no sense at all. But,
well, you mentioned Darwin, the remote city. There's a lot of other remote points, in the north, in the west, and inland. And I'm just wondering, even with the communication system you're talking about, a lot of them don't have reception that works with these.
Yep.
Is there any way of getting some satellite places like Mount Isa, Tennant Creek, places like that, equipped with some special facilities, because at least they're reasonably close to them?
Yeah. Well, the answer is yes. I mean, look, for me, we can teach somebody in a day, maybe 2 days, how to diagnose and treat skin cancer, basically, right? It's not brain surgery. It's really quite simple as far as diagnosis. But as far as then having, let's say, nurses or even a technician, to be honest, be able to take a photo that then gets sent to a dermatologist. We all even know how to pick up the camera and plug it into the software. So yes, the answer is you can, easily. What's interesting at the moment is the federal government have created item numbers for video conferencing, right? So this is part of the NBN rollout. So let's justify why we're spending the money is because we need super fast broadband so we can have video conferencing. The problem is, if you can't get into a dermatologist for 6 months, what makes you think you're going to get a video consult next week? I mean, they've got to stop seeing patients, and then you've got to have the GP, the patient, and the dermatologist all available at the same time. And I'm sorry, but the webcam that sits on your thing is not good enough quality for me to show you my mole to tell me what it is. So we use a thing called store and forward, which is the ability to take a photo, send it, get it reviewed, and the report sent back, which is the most efficient way of doing this. But the federal government at this point in time is choosing to go with video conferencing because it justifies what they're doing. Yeah.
Could I just clarification? So somebody who just wants to check themselves out with skin cancer picks up a phone and reads a click at one way bay.
Yep.
Goes in theirs. Are they seeing GP at first?
GP.
Technician?
Yeah.
It has to be a GP.
Yeah, I mean, in Australia, you can't deliver a medical service. Well, I'm not saying you can't. You effectively don't get Medicare rebates, and you are playing in very dangerous territory if you're not obviously a doctor. I mean, I can argue there are probably nurses out there that are probably better at GPs than diagnosing skin cancer, just because they do that a lot. A lot of dermatologists rely on their nurses. That's how they're able to manage as many patients as they have. But yeah, typically they're a GP, and what the GP should say when you first go and see them, should say, "Hello, Michael. I'm, Dr. Bob. I'm a GP with a special interest in skin cancer. Not I'm a dermatologist that's working in a skin cancer clinic." There's a lot of the criticism we had when we first built the clinics. Everyone said, "Well, hold on, what do people think these are dermatologist practices?" Well, we very quickly put into our policy and procedures is that we introduce ourselves as a GP with a special interest. But once again, there are GPs, I mean, there's probably about 800 GPs in Australia who focus on doing skin cancer as a large part of their practice. There's probably about 300 that do it full-time. So there's almost more GPs doing this full-time than dermatologists. So, in the whole of the country. Yes?
Is there any truth of the old story I heard about they use a scope with a different coloured UV light, different frequency light, and it's better for detecting cancers? There's no truth in that.
The whole thing is you standing there in your underwear, someone looking at you, someone looking at whatever your funny thing that doesn't look quite normal. I mean, if you look at someone's back and they've got 50 moles, they're not going to have 50 melanomas. What they're looking for is the odd one out, and that's what they actually look at. It's called the ugly duckling. So the doctor is really just trying to find that odd thing that doesn't look right. You pointed it out, or they don't like the look of it, and that's what they basically do. If they find something they don't like the look of, they then should take a biopsy. In other words, it's like the end of a pen, stab you, or just then they can send the skin cells off to the pathology lab. They get a definitive diagnosis. I mean, doctors who go straight from skin check to cutting something out is not really ideal, because you're cutting things out on many occasions which don't need to come out because there's nothing wrong. They might look ugly, but they're not actually a cancer of any description. So the ideal thing is get undressed, your doctor starts looking in between your hair follicles and finishes somewhere in between your toes, rolls you over, does the same thing. That's a proper systematic exam, bend your ears, look properly. If they find something, they should then take a sample. If they think it's a melanoma, they actually will cut it out, because melanoma they want to see where it extends to. So I'm not saying cutting it out is not done at all. If it's a melanoma, but once again, that's a very small percentage of what we deal with. And then when the result comes back, we know that if it's a low-level cancer, we can treat it with a cream or something else. If it's more advanced, then we have to unfortunately pull out the blade and cut it out of you. But it's very easy to treat. That's the whole point. If you get it early, it's 100% curable. Just about. If you ignore it, does it get nasty?
There is no colour difference if you use different frequency lights, I suppose.
No. Other than looking at your skin, no.
Yeah.
Excellent. I'm happy to answer any other questions if you have later, but thank you very much for your time.
Wow. You burst your buttons on your shirt, Dad? I would. I don't know if you were like me, sitting there thinking, reminiscing back to probably about 30-something years ago, actually it's probably longer than that, but that'll do. Covering myself in baby oil and sitting on the top of my father's garage, which was a tin roof, and you all know my pale skin, the damage I could have done to myself. So we've certainly come a long way, and especially with people like you, Paul. I'm really glad that the Sony music entertainment industry lost you, and that you could come forward to be able to, help us, and not only us here in Australia, but also to the rest of the world with your innovative programs, etc. We wish you every success. We don't have a certificate of appreciation for you today, because that's one less thing you'll have to pump into a suitcase to take overseas with you when you move. But I'm sure that Proud Dad here will keep us abreast of the challenges, and also to all of your successes, and I'm sure there's going to be plenty of those. Thank you again for sharing your story with us today. Thanks.
Yeah.